If your blood pressure suddenly spikes, the worst thing you may do in that moment is what almost everyone does first. Because panic can drive those numbers even higher, and there's a hidden switch inside your body that can interrupt it in minutes, but almost no one over 60 has been taught how to use it. One of these breathing tricks stopped a patient from rushing to the ER at 2 Man, but the third technique is the one doctors almost never mention, and once you hear why, you may never look at a blood pressure spike the same way again. If you're serious about taking better care of your health, make sure you subscribe. I share simple, practical advice designed especially for seniors. And feel free to leave a comment telling me where you're watching from. I appreciate every one of you. Let's get back to it. You already know the feeling, not the number on the monitor, not the doctor's voice. The feeling, that sudden awareness deep in your chest, a heaviness, a quiet drumming behind your ears, that something inside you has shifted into overdrive without your permission. Maybe it happened after a phone call you weren't expecting. Maybe it was the second flight of stairs on a bad day. Maybe you sat down in a perfectly calm room, checked your blood pressure out of habit, and the number staring back at you made your stomach drop. And here's what nobody tells you about that moment. The moment you see that number, your blood pressure often spikes again. Because your body just received the most alarming news it could get, and it responded the only way it knows how. Fear triggers pressure. Pressure triggers fear. And the cycle feeds itself in a loop that most people have no idea how to stop. But what if I told you your body already has a built-in switch that can interrupt that loop not in weeks, not with a new prescription, but within minutes of using it correctly? It doesn't require equipment. It doesn't require a gym, a pharmacist, or a follow-up appointment. It requires something you've been doing every moment of your life, something so automatic you've never once had to think about it. Your breath. Now, before you dismiss that, stay with me, because what I'm about to show you isn't relaxation advice. This isn't just calm down and breathe deeply. That's not what this is. This is about understanding that your lungs are in constant communication with your cardiovascular system, sending signals that either tell your blood vessels to tighten or to release. And most people over 60 are sending the wrong signal without knowing it. I'm going to show you 3 specific techniques, each one targeting a different blood pressure trigger. The first works fast. The second may do something most people don't expect. It may gradually shift where your baseline pressure starts. And the third, the one I want you to remember, is what I call a pressure panic interrupt. It's what one of my patients used at 2 a.m. when he was convinced something had gone very wrong. He sat on the edge of his bed, heart pounding, certain he needed emergency help. He didn't call anyone. He used this technique for 4 minutes, and by the time he rechecked his numbers, they had dropped. I'll show you exactly what he did. But first, you need to understand something about why blood pressure spikes so suddenly in older adults, and why the instinct most people follow in those moments may be quietly making things worse. That's where we're going next. Most people assume blood pressure spikes begin in the heart, or in the arteries, or somewhere deep in the body's plumbing, something mechanical, something structural, something that can only be fixed from the outside with a pill or a procedure. But here's what years of working with older adults taught me, and what most standard appointments don't have enough time to explain. Many of the fastest, most frightening blood pressure spikes don't begin in your arteries at all. They begin in your brain. Specifically in the part of your nervous system responsible for deciding whether you are safe or in danger. Here's how it works. Your body runs on 2 competing systems: the sympathetic nervous system, your accelerator, and the parasympathetic nervous system, your brake. When life is calm, these 2 stay roughly balanced. Heart rate steady, blood vessels relaxed, pressure normal. But the moment your brain perceives a threat, whether that threat is real or simply felt, the accelerator slams down. Adrenaline floods your bloodstream within seconds. Blood vessels constrict. Your heart beats harder and faster to push blood through narrower channels. And pressure climbs. Now here's the part that surprises most people. Your brain cannot always tell the difference between a genuine physical emergency and a frightening number on a blood pressure monitor. To your nervous system, both feel like danger, which means the act of worrying about your blood pressure can trigger the exact biological cascade that raises it further. Researchers studying this phenomenon have a name for it: the anxiety hypertension feedback loop. A 2021 review published in the Journal of Human Hypertension confirmed that psychological stress and anxiety are significant independent drivers of acute blood pressure elevation, separate from diet, age, or medication status entirely. You read that correctly. Stress alone, fear alone, can push those numbers up fast. I once treated a patient named Gerald, 73 years old, controlled diet, on medication, doing everything right. But every time he checked his blood pressure at home, his readings were alarmingly high. At his appointments, they were almost normal. So we ran an experiment. We asked Gerald to check his monitor, but cover the screen before reading it. Breathe normally. Wait 2 minutes, then look. His numbers were consistently lower. The act of anticipating a bad result was manufacturing one, and Gerald is not unusual. This happens more than most people realize, especially in adults over 60, whose nervous systems have often spent decades in low-grade, chronic stress without anyone addressing it directly. So why does breathing matter? Because breathing is the only function in your body that operates both automatically and under your conscious control. Every other organ in that cascade, the adrenal glands, the blood vessels, the heart, responds to signals it receives. But your breath sends the signals, which means you have more influence over that chain reaction than you've ever been told. And the first technique is about to show you exactly how much. So now you understand what's actually happening inside your body when pressure spikes. It isn't random. It isn't mysterious. It's a signal chain, and your breath sits at the very beginning of that chain. Which means the moment you change how you breathe, you change what your body believes is happening to you. And the first technique exploits something most people have completely backwards. When blood pressure rises, the instinct almost everyone follows is the same. Take a deep breath in. Big inhale. Fill the lungs. Hold it. It feels like the right move. It feels controlled, intentional. But here's what the science actually shows, and this surprised even some of my colleagues when I first brought it up. The inhale is not where the power is. The exhale is. Here's why this matters. Your heart rate and your breathing are connected through a mechanism called respiratory sinus arrhythmia. During inhalation, your heart rate naturally speeds up slightly. During exhalation, it slows down. This isn't a flaw. It's a feature. Extended exhalation directly activates the vagus nerve, the longest nerve in your autonomic nervous system, running from your brainstem all the way down through your heart, lungs, and digestive organs. When the vagus nerve activates, it releases a neurotransmitter called acetylcholine, which signals blood vessels to relax and the heart to slow its rhythm. A landmark study, published in Frontiers in Human Neuroscience, found that prolonged exhalation breathing significantly increased vagal tone and produced measurable reductions in heart rate and blood pressure within just a few minutes of practice. This is not relaxation folklore, this is physiology. So here is the technique. It's called the long exhale reset, and the ratio is simple. Breathe in for 4 counts, breathe out for 8. Twice as long out as in. That's the entire instruction. Let's do it together right now. Breathe in through your nose slowly. 1, 2, 3, 4. Now breathe out even slower. 1, 2, 3, 4, 5, 6, 7, 8. Again. In 1, 2, 3, 4. Out 1, 2, 3, 4, 5, 6, 7, 8. One more round. In feel your chest rise. 1, 2, 3, 4. Out let everything release. 1, 2, 3, 4, 5, 6, 7, 8. Now pause. Check your shoulders. Are they lower than they were 30 seconds ago? Check your jaw, your hands, the space behind your eyes. Something has already shifted, not dramatically, but measurably. That's your vagus nerve responding exactly the way it was designed to. I had a patient, William, 68 years old, retired electrician, who called this technique his pressure dial. Every morning before breakfast, every evening before bed, 4 in, 8 out. 3 minutes each time. He wasn't doing it during spikes. He was doing it before they could build. And that's the twist most people miss with this technique. The long exhale reset is powerful during a spike. But it becomes even more effective as a daily practice, because consistent vagal stimulation over time helps recalibrate where your nervous system's default setting rests. You're not just calming a single storm, You're gradually changing the weather pattern. William told me after 6 weeks that his home monitor readings in the mornings, historically, his worst had quietly dropped by nearly 12 points, systolic on average. He hadn't changed his diet, hadn't adjusted his medication. He had simply learned to exhale longer than he inhaled. Now, if that technique works on daily tension and mild spikes, the second technique operates on an entirely different level. Because while the long exhale reset calms the nervous system, what comes next may actually begin to retrain it over time. And the science behind how it does that is unlike anything most older adults have ever heard explained. What you just learned works. But it works the way a good umbrella works. It protects you when the storm hits. What I want to show you now is something different, something that may change the forecast entirely. Because while the long exhale reset targets your nervous system in the moment, this second technique works at a deeper level. It doesn't just calm the system that drives blood pressure up. Over time, it may quietly shift the baseline that system operates from. And it requires nothing more than a specific breathing rhythm most people have never deliberately used. 6 breaths per minute. That's it. 1 breath every 10 seconds. 5 counts in, 5 counts out. It sounds almost insultingly simple, but the physiological effect of that specific rhythm is anything but simple. Here's what happens inside your body when you breathe at 6 breaths per minute. Your breathing pattern begins to synchronize with your heart's natural rhythm, a phenomenon researchers call cardiovascular resonance. When this synchronization occurs, something remarkable follows. Heart rate variability improves dramatically. And heart rate variability, the natural variation in time between your heartbeats, is one of the most powerful indicators of cardiovascular health and autonomic nervous system balance that medical science currently measures. A 2019 study published in Psychophysiology found that slow-paced breathing at approximately 6 cycles per minute significantly increased heart rate variability and produced notable reductions in blood pressure among hypertensive adults effects that persisted even after the breathing session ended. Read that last part again. Even after the breathing stopped. That's not a calming technique. That's a training effect. I want you to try it now. 5 counts in 1, 2, 3, 4, 5. 5 counts out. 1, 2, 3, 4, 5. Again, keep it smooth. No forcing. No gripping the breath. 5 in 1, 2, 3, 4, 5. 5 out. 1, 2, 3, 4, 5. Let your body find the rhythm. This is 6 breaths per minute, and if it feels slightly slower than comfortable, that's exactly right. You're working at the edge of your natural pattern, which is precisely where the retraining happens. I had a patient, Clarence, 71, former high school principal who had what cardiologists call white coat hypertension. Around doctors, around medical equipment, around anything clinical, his readings would surge. At home, nearly normal. His cardiologist was frustrated. His readings at appointments simply didn't reflect his daily reality. So, Clarence started practicing this rhythm. 5 minutes every morning, 5 minutes every evening, sitting in his armchair with his eyes closed. Within 3 weeks, something shifted. Not just his readings, his reaction to the readings. The anxiety that used to grip him the moment a blood pressure cuff tightened began to loosen. His cardiovascular system had learned through repetition that the monitoring moment was not a threat. At his next appointment, his systolic reading was 14 points lower than his previous visit. His cardiologist asked what medication he had changed. He hadn't changed anything. He had simply breathed slower, deliberately, every single day. Now the long exhale reset calms the storm. The 6-breath rhythm retrains the forecast. But neither of them is what I reach for when someone tells me their pressure is spiking right now, this moment, and panic is already taking hold. For that, there's a third technique. And it was built for emergencies. Everything we've covered so far has been about management. Daily resets, baseline retraining, gradual recalibration, all of it valuable, all of it necessary. But none of it is what you reach for at 2 in the morning, when your heart is pounding in your ears, your hands are trembling, and your mind is already racing toward the worst possible conclusion. For that moment, and I want you to hear this clearly, you need something different. You need a pattern interrupt. Not a gentle nudge to your nervous system, a full stop, a hard reset, something powerful enough to break the anxiety spiral before it drives your numbers into dangerous territory. Because here's what most people don't realize is happening during a sudden pressure surge. The spike itself is rarely the only problem. The reaction to the spike becomes the second problem. Your pressure rises, you feel it, fear ignites. Adrenaline surges in response to the fear. Blood vessels constrict further. Pressure climbs higher, which generates more fear, which generates more adrenaline. Round and round, faster and faster, each revolution tightening the spiral. And unless something breaks that loop, the body has no natural off-ramp. This technique is the off-ramp. It's called box breathing, and while it may sound familiar, it was not developed for relaxation classes or wellness retreats. It was developed for high-stakes environments where cognitive function and physiological control had to be maintained under extreme stress. Military special operations units have used structured versions of this technique for decades, precisely because it works when conditions are at their worst. A 2023 study published in Scientific Reports found that box breathing significantly reduced salivary cortisol levels, the body's primary stress hormone, and produced measurable drops in both systolic and diastolic blood pressure within 4 minutes of practice. 4 minutes. Here is how it works. 4 counts in, hold 4 counts. 4 counts out, hold 4 counts. Like tracing the 4 equal sides of a square with your breath. Let's do one full round together right now. Breathe in 1, 2, 3, 4. Hold 1, 2, 3, 4. Breathe out 1, 2, 3, 4. Hold 1, 2, 3, 4. Again, in 1, 2, 3, 4. Hold 1, 2, 3, 4. Out 1, 2, 3, 4. Hold 1, 2, 3, 4. Notice what the hold does. That deliberate pause, both after the inhale and after the exhale, forces your mind to anchor completely in the present moment. There is no room for catastrophic thinking inside those 4 counts. Your entire cognitive attention narrows to one thing, the count, and that narrowing is exactly what breaks the spiral. Now, let me tell you about Raymond, 66 years old, retired firefighter, a man who had spent decades running toward emergencies rather than away from them. He called me on a Tuesday night, voice tight, telling me he had woken from sleep with his heart hammering, convinced something had gone seriously wrong. His home monitor read high enough to frighten him. He was already reaching for his phone to call for help. I told him to put the phone down and give me 4 minutes first. Box breathing, 4 counts each side, continuous rounds. He called me back 8 minutes later, calmer, steadier, numbers meaningfully lower. He told me the most remarkable part wasn't the reading on the monitor. It was the moment, somewhere around minute 2, when the panic simply broke, like a fever lifting. Because that's the deeper truth about what this technique does. Yes, it influences blood pressure through cortisol reduction and vagal activation, but its most immediate power is psychological. It reminds your nervous system that you are in control. And when your nervous system believes that everything downstream changes, you now have 3 techniques, 3 distinct tools targeting 3 different moments. But a tool sitting in a drawer helps nobody. What comes next is how you turn these 3 separate techniques into a single working system, one that fits inside your actual daily life and compounds in effect the longer you use it. That's where the real transformation begins. 3 techniques, 3 different mechanisms, 3 different moments, 3 different targets inside the same biological system. Used separately, each one is useful. Used together deliberately, consistently, in the right sequence, they become something else entirely. They become a protocol, and that distinction matters more than most people realize. Because here's the mistake almost everyone makes after learning something like this. They save it for emergencies. They file it away, mentally good to know, might need that someday, and then return to their normal routine until the next frightening reading forces them to remember it. And that approach throws away 80% of the value. Think of it this way. You wouldn't only use your blood pressure medication during a spike. You take it consistently, because consistency is what builds the therapeutic effect. These techniques operate on the same principle. Repetition is the mechanism. not the technique itself. So here is how the three fit together into a daily structure that actually works. The long exhale reset is your morning and evening anchor. 4 counts in, 8 counts out. 3 minutes when you wake, 3 minutes before sleep. This is your daily nervous system maintenance, the equivalent of keeping your cardiovascular system in a resting, receptive state, rather than a perpetually braced one. Think of it as keeping the pressure valve loose before tension ever has a chance to build. The 6-breath rhythm is your training session. 5 minutes, twice daily, mid-morning and mid-afternoon work well for most people. This is not about calming a spike. This is about incrementally improving your heart rate variability, strengthening vagal tone, and gradually shifting the baseline your body defaults to when nothing unusual is happening. This is the long game. And the long game is where the real numbers move. Box breathing is your emergency tool. 4 counts in, hold 4. 4 counts out, hold 4. Reserved for moments of acute stress, sudden spikes, nighttime surges, or any situation where panic is beginning to layer on top of an already elevated reading. Deploy it immediately. Give it 4 minutes minimum before reassessing. Daily anchor, training session, emergency rescue, reset, retrain, interrupt. That is the complete system. I had a patient named Clifford, 74, former accountant, meticulous about tracking everything. He built a simple log: morning reading before the long exhale reset, morning reading after, evening reading before bed, 1 line per day. Week 1, modest fluctuations, nothing dramatic. Week 3, his morning baseline had quietly dropped 7 points systolic. Week 6, 14 points lower on average than when he started. His physician reviewed the log at his next appointment and asked what had changed. Clifford slid the notebook across the desk. The physician sat with it for a long moment, then looked up and said, "Why didn't anyone teach this sooner?" That question stays with me, because Clifford hadn't been given a new medication, hadn't overhauled his diet, hadn't joined a program. He had simply organized 3 breathing techniques into a daily sequence and refused to skip it. Consistency did what the techniques alone could not. But before you walk away thinking you have everything you need, there's one more thing. Because even people who commit to this protocol often make a small handful of mistakes that quietly cancel out their results. And the most common one is something almost nobody warns you about. You now have the full protocol: the anchor, the training session, the emergency interrupt, a daily structure that compounds the longer you apply it consistently. And yet I have watched motivated, genuinely committed people follow these techniques and still see disappointing results. Not because the techniques don't work, because of 4 specific mistakes that silently undermine everything. Mistake 1, breathing too hard. When most people hear deep breathing, something clicks that says effort, so they force it. Big dramatic inhales, shoulders rising, neck tightening. And that muscular tension, the very tension you are trying to release, gets reintroduced through the back door. Effective breathing for blood pressure is never forceful. It is slow, low, and soft. The movement should come from your diaphragm belly, expanding outward, not your chest climbing upward. Research in applied psychophysiology and biofeedback confirmed that diaphragm-driven breathing produced significantly greater reductions in sympathetic nervous system activity compared to chest-dominant breathing, even at identical breath rates. Mistake 2, only practicing during emergencies. Box breathing during a spike will help. But if your nervous system has never rehearsed that pattern in calm conditions, its ability to execute under acute stress is significantly reduced. Practice when you don't need it so it works reliably when you do. Mistake 3, expecting immediate permanent results. Research on slow breathing interventions shows clinically meaningful blood pressure reductions emerging between 3 and 8 weeks of daily practice. The timeline is not a flaw. It is how physiological adaptation works. Patience is the active decision to keep showing up. Mistake 4, holding your breath without realizing it. Emotional stress causes unconscious breath holding throughout the day, quietly keeping your sympathetic system activated between practice sessions, several times daily. Simply notice your breath. Is it moving? Is it shallow? Awareness alone begins to interrupt the pattern. Avoid these 4 mistakes, and everything you have learned, becomes exponentially more powerful. Which brings us to the final piece. Because knowing all of this means nothing without one last thing: a clear, honest, immediately actionable plan for what you do starting today. You came here because something about your blood pressure concerned you. Maybe a number, maybe a feeling, maybe that quiet, persistent worry that settles in your chest every time you wrap that cuff around your arm and wait. Whatever brought you here, recognize this before we close. You didn't just watch a video. You learned why blood pressure spikes so fast and what's actually driving it. You learned that your breath is in constant communication with your cardiovascular system and that you can change what it's saying. You learned 3 techniques, each targeting a different moment, and exactly how to combine them into a daily protocol that builds on itself the longer you apply it. That is not a small thing. So here is your action plan. Not someday, tonight. Pick one technique and practice it before sleep. If you are calm, use the long exhale reset. 4 counts in, 8 counts out, 3 minutes. Tomorrow morning, add the 6-breath rhythm before you check your monitor. Let your nervous system arrive at that moment already settled rather than braced for bad news. Write your readings down this week. 1 line per day. Give it 14 days before you judge anything. 14 days will show you what no single session can the direction your baseline is actually moving. And share what you are doing with your physician. These techniques support your medical treatment. They don't replace it, but your doctor deserves to know, and your data gives them something genuinely useful. Clifford dropped 14 points over 6 weeks. Raymond broke a midnight panic spiral in 4 minutes. William shifted his entire morning baseline by learning to exhale longer than he inhaled. None of them did anything extraordinary. They simply showed up correctly, consistently, without quitting. Your breath has been with you every second of your life. You just never knew how to use it with intention. Now you do. Thanks for watching all the way through. Staying informed is key to living a healthier, longer life. If you want more simple, practical health advice, make sure you subscribe and tap the next video on your screen. And before you go, leave a comment and rate this from 1 to 10. Your feedback helps me create better guidance for you.